I'm Dr. Robert Peppercorn, and this is the Yuba Sutter Medical Explorer. As a specialist in skin diseases and allergies, and as host of this program, I will take you on an exploration of the medical communities of Yuba and Sutter counties and bring you behind the scenes of medical care practices right here in our local area. Tonight we will explore several interesting and diverse areas of medicine. We will meet a new health professional who has come to our area called a lactation consultant. Lactation refers to breastfeeding of babies, and our guest tonight is one of California's leading experts in this unique health teaching area. Tonight we will also discuss new developments that are taking place at Rideout and Fremont hospitals with their Director of Public Relations and with the Chief of Cardiology at Rideout, Dr. Henry Louie. In the pharmacy corner tonight, our neighborhood guest pharmacist will tell us about the rarely discussed subject of laxatives. Are over-the-counter laxatives totally safe? Well, we'll learn the answer to this question and others about laxatives in the pharmacy corner tonight. Tonight's show will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our main topics tonight, let's take a look at the latest medical news. For the 48% of us who take our daily vitamins, the growing controversy over their value and safety could be a bitter pill to swallow. That controversy took another turn this week when a panel of doctors asked colleagues to monitor patients' vitamin use. The panel, sponsored by the American Dietetic Association, voiced concern over the rising use of vitamin and mineral supplements, citing possible toxic effects from megadoses taken by as many as 10% of us. That concern, though, isn't unanimous. There's no good scientific evidence that supplements taken at reasonable doses have caused a true toxic reaction, according to researchers at a Washington State University study. Except for such groups as pregnant and lactating women, some elderly, and those on certain drugs, there's no justification for taking vitamins and minerals to cure or prevent disease, according to the Chief of Nutrition at the UCLA School of Medicine. Among the vitamins that may be toxic in high doses are vitamin A, that can cause liver damage, vitamin C, which can cause kidney stones, vitamin D, which could damage the kidneys in high doses, vitamin E, which can cause thyroid problems, and vitamin B6, which has been observed to cause nerve damage in excessive doses over a long period of time. Contrary to what many doctors believe, insulin injections control diabetics, as well as more popular oral drugs, according to a new research study. Researchers at the Mayo Clinic in Minnesota compared the effectiveness of insulin injections with the drug talazomide in 8 patients with non-insulin-dependent diabetes, which affects about 4 million in the United States today. Researchers found that both treatments were equally effective in maintaining a safe blood sugar level. Many doctors have thought talazomide and similar drugs were more effective than insulin injections in these patients, and many other doctors disagreed. This study is the first evidence that insulin injections work just as well as those oral drugs. Could it be that there could be a benefit in having morning sickness? A recent study shows that women who vomit in the early months of pregnancy are less likely to suffer miscarriages than women who don't. It seems that a certain amount of morning sickness indicates that the pregnancy is progressing well, according to doctors at the National Institute of Child Health and Human Development. The nausea and vomiting are probably a sign that there are higher levels of pregnancy-related hormones present in the woman's body. Morning sickness was more common among first-time mothers, teenager mothers, mothers over 170 pounds, and non-smoking pregnant women. Could this mean those factors are healthy? Well, time will have to tell. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's leading neighborhood pharmacists. Joining us tonight in the pharmacy corner is Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
I understand that people are constantly asking you about the safety of taking laxatives. Could you tell us about some of the reasons that lead people into getting used to laxatives?
Yes, I have prepared a little bit here tonight on laxatives and constipation. I'll go over that with you. Constipation can be caused by one or more of a variety of factors, including ignoring the defecation urge, environmental changes, lack of sufficient bulk or fluid in the diet, consumption of constipating foods and drugs, chronic misuse of stimulant laxatives, and advanced age. Constipation can often be prevented or treated successfully without the use of drugs, and this is accomplished by the use of non-drug measures such as consumption of a diet containing adequate fiber and fluid and regular exercise. Laxatives are generally classified according to their mechanism of action. The classes of laxatives include stimulants, saline laxatives, bulk formers, lubricants, and stool softeners. The stimulants are the most widely used and most commonly abused of all the laxatives. The popularity of these agents is undoubtedly the result of their prompt and thorough action. All appear to increase the propulsive activity of the intestine. Stimulant laxatives must be used with considerable restraint in all cases and must be used only with great caution in people who experience symptoms of appendicitis, such as abdominal pain, nausea, and vomiting. Stimulant laxatives should not be used continuously for more than 1 week and should not generally be used as the initial therapy for constipation. The use of saline laxatives should be limited to the situations requiring the rapid and complete evacuation of the bowel, such as preparation for patients during certain diagnostic examinations. Because of their relative safety and effectiveness, bulk-forming laxative products, which contain non-absorbable fiber and increase the fluid content of the intestine, are considered to be the best choice for the initial treatment of constipation. Bulk-forming laxatives swell in the GI tract and serve to facilitate the movement of the intestinal contents and provide the bulk which promotes the intestinal activity. Because of their gentle action, bulk-forming laxatives may not produce visible relief of constipation for 1 to 3 days. Stool softeners, when administered orally, increase the wettability of the stool. This permits water to move into and penetrate the fecal mass and maintains the stool in a softer, more easily passable form. They are of no value in the treatment of existing constipation, but are useful in situations which require the feces to be kept soft and where straining at the stool is to be avoided. For example, in people with severe hypertension or cardiovascular disease. If you are considering the use of a laxative product, you should consult your physician and allow he or she to determine which product is best for you during your current health status.
Bob, in the world of medicine and healthcare, people are taking many different medications. They're not laxative medications, but medications for blood pressure, medications for heart disease, other types. Are there any specific medications that might cause a person to become constipated and then need laxatives?
Yes, some that come to mind right off the top would be certain antacids, especially those containing aluminum or calcium products. A lot of pain medications, especially those containing codeine or codeine derivatives. Some antidepressants, anticholinergic drugs, which are used to slow intestinal motility and decrease the amount of acid being dumped into the stomach. Some anti-Parkinson type drugs. So yes, there are a lot of drugs that can cause problems.
What are these things we read about in health magazines? They call them suppositories. Sometimes they have glycerin suppositories. What are those?
Been around for a long time, glycerin suppositories, and we have questions about those from a lot of people. Are they really effective? Yes, they are. They work by 2 ways. They draw more fluid into the intestinal tract, and they irritate the intestinal lining, which causes propulsive action. They're effective within 30 minutes of administration. But you have to be careful because prolonged or regular use of those can cause irritation of the rectal lining, and that's not good.
Very important information. Bob, I feel this was very useful today, and I hope that our viewers will discuss their laxatives with their physicians and medical specialists as well as with their pharmacists as soon as they have that next opportunity to do so. Perhaps we can have you return to the Pharmacy Corner on a future Medical Explorer
I'd like to do that. Thank you.
Thank you very much.
You're welcome.
The subject of breastfeeding is rarely brought up on radio and television health programs. Even though you might not think so, successful breastfeeding requires a significant amount of knowledge and understanding. Our guest tonight is one of California's few expert health professionals who specializes in the area of breastfeeding. I'd like to introduce you to our special guest, Sheila Mead, lactation consultant. Mrs. Mead, welcome to the Medical Explorer tonight.
Thank you.
Thank you for being with us. I always like to begin by having our guests tell our viewers about their educational background and training. Where did you get your education?
Oh, I am an RN, and I have worked at Roseville Community Hospital for the last 6.5 years And then I went through a program at the University of California, Los Angeles, with Kitty France, who is an expert in breastfeeding.
And you're at Roseville now. Is this the only thing you do over at Roseville, or is this one of the things you're involved with?
I also work in the nursery, and I counsel moms.
I see. So it's a full-time position over
Yes.
there. What should a woman know about breastfeeding to get to the best start when they're just getting ready to start breastfeeding? What do they need to know?
Okay. One of the first things that she should do is check her nipples, and this should be done initially as soon as she finds out that she's pregnant. And we want to pinch the areola, which is the brown part of the breast, with the thumb and the forefinger, and watch what happens to the nipple. And she needs to check each breast because they might be different. The top one is called inverted. That means the nipple goes out. This one, the nipple stays flat, and the bottom one, the nipple goes in. And the significance of this is that the baby has to latch on to the areola, which is the brown part of the breast, and his mouth has to compress that area in order to get the milk. The milk is made up here and travels down in ducts and sits in sinuses behind the areola. So if he does not feel the nipple stimulation, he becomes frustrated, and it's like trying to latch onto a bowling ball. Another important part is for the mom to know about positioning. When you position the baby to nurse, you put the baby completely on her side with her tummy next to your tummy, the head in the crook of your arm, your hand holding her buttocks, and this arm down here. By properly aligning the baby can then latch on to the breast. And when I say latch on, that means to hold your hand on the breast with thumb on the top and fingers below, tickle the baby's mouth with your breast, and wait for him to open up his mouth. As he opens up his mouth, then, you want to make sure he opens wide, okay? As he opens his mouth, then you want to ram him onto the breast. Okay, next one. You can see that his nose is touching the breast, and you want the chin also touching the breast. Do not be afraid that the baby cannot breathe. He can breathe just fine. This shows incorrect positioning. The baby's flat on his back, and the mom is holding his head in her hand, and she's got where we turn the cigarette hold. She is obstructing where he is supposed to latch on.
Yeah, there's really a lot more to this than I had imagined. There's really a specific science to the technique of breastfeeding. There seems to be controversies about whether breastfeeding is healthier than formula feeding. Is that a controversy, or are there facts about that?
Facts. Breastfeeding is the most natural and nutritious source for the baby. It promotes infection and to gastrointestinal and respiratory infection, and minimizes or delays the chance of allergy and
so the antibodies that are in the breast milk fight infection and make it a lot healthier in that way. Do all health professionals now agree that breastfeeding is more healthy than
I think so.
milk feeding and that sort of formula feeding?
Yes.
That's interesting. How often does a newborn baby, have to be breastfed?
Okay, this might be a shock for moms. They have to be fed from every hour and a half, 2 hours to every 3, and that's because the protein curd in the breast milk is very easily digested. And so the breast milk is digested in about 90 minutes, and that is why.
Gee, that means through the night as well, doesn't it?
Yes,
They're not going to get a lot of rest.
Initially, it will decrease as the baby gets older.
So they shouldn't try to have a breakfast, lunch, and dinner like they might be doing themselves.
Right.
Each time a woman then is breastfeeding her baby, it's about how long? About how many minutes then?
An average time is between 20 and 30 minutes, and I'm talking average. It could be shorter, but it could be longer.
Does the size of a woman's breasts affect her ability to breastfeed?
Size has nothing to do with the breastfeeding, no.
So the volume of milk is there?
Yes.
That's interesting.
You want to incorporate the positioning and the latch on to get the milk. And she has to remember that supply equals demand. If the baby sucks, the baby's making milk.
I'm going to ask you a question you might consider silly, but a patient of mine asked me this one day, and I felt I have to ask you this too. She was wondering if, while breastfeeding, it would actually help her lose weight because her body was losing minerals and things. Is there any sense to that she would lose weight from breastfeeding?
Yes. As a mother, during pregnancy, she puts on about 10 pounds of fat. And in order to make milk, she's burning about 900 calories a day. So she's losing weight by breastfeeding and not even exercising.
Maybe it wasn't a stupid question. It was a real good question. Are there any foods that should not be eaten when a woman is breastfeeding?
No, a lot of women think they should stay away from, say, chocolate or whatever. And I would say eat a variety of foods in moderation. If she is prone to allergy or some sort of sensitization to, say, strawberries or chocolate, then more than likely her baby will be too.
Will the baby need additional water supplied besides what's in the breast milk?
No, as long as she's willing to feed the baby when the baby wants to be fed. She can drink the water and he can get the water through the milk.
Is there ever a reason to combine breastfeeding with bottle feeding? Can that be done? Is that safe to do?
It's recommended that she breastfeed for a good 2 weeks, and then she can give the baby a bottle so that he will take a bottle, and give it to him about every 3 to 4 days to keep him acquainted with the bottle. She has to realize the sooner the baby gets a bottle, the more likely he will be to go to bottle feeding instead of breastfeeding. But moms are working now, and it can be done, yes.
Now tell me, how though could a woman who's working full-time, 8 hours a day, stop every hour, hour and a half to breastfeed? How's that done these days?
Well, if she goes back to work sooner than 6 weeks, that is hard because she does have to breastfeed the baby about 10 times a day. But if she can wait to go back to work later, then the baby is breastfeeding less, okay? She can do it a couple different ways. She can maintain a 24-hour milk supply and pump her breast at work and feed the baby when she's at home and
Pump?
on her
What
days.
do you mean pump? I'm not sure our viewers know what that means.
All right. Pump means to get the milk out of the breast.
Are there devices available that can be used to
Yes.
save this milk? What are they called? Breast pumps?
Yes.
Where
There's
would
hand pumps and electric pumps.
Where would they get these things?
Hand pumps are available in pharmacies and also through Medela and Egnail, and those are the 2 rental depots for electric pumps.
Are there any specific names of pumps you would recommend over others?
Caneson, K-A-N-E-S-O-N, or the Marshall breast pump. Most of them are all look alike. They're a long cylinder type thing, and those are the kind that are recommended.
So then the milk can be saved and given different times. It might not be convenient at that particular instant. That's interesting. Can the milk be frozen and saved?
Oh, yes. The milk can be put in a refrigerator for up to 48 hours, unless you have a high-use refrigerator, and then it can be put in a freezer for about 2 months. If you have a deep freezer, it can be up to a year.
Wow, no idea. Can a premature baby be breastfed, a real small baby?
Yes. The mom has to realize there's some commitment for pumping for 1 to 3 months until the baby is able then to nurse.
Does the shape of a woman's breasts ever return to the size and shape of what they were before the pregnancy, before the breastfeeding?
Well, she has to realize that the pregnancy is what causes the change in the breast, and so breastfeeding really has nothing to do with that. And she has to remember heredity plays a part in that.
Very important. I understand you've written a publication on the subject of breastfeeding. Is this available to people? Can they purchase it from you?
Yes.
How would they go about getting it? What would they have to do?
They can contact me through Roseville Community Hospital, 333 Sunrise, Roseville, in care of the nursery.
It's fascinating that there are experts in this field. Going to medical school, I was at Johns Hopkins, which we like to consider as being one of the best. This didn't come up as a subject where there were experts, and I'm delighted to see that our community has an expert like yourself available that people can call at the Roseville Community Hospital. Sheila Mead, lactation consultant. Thank you very much for being with us tonight and taking time out of your schedule and coming all the way out to Yuba City.